So, welcome back to the continuation of pulse. We started with the definition as well as the bradycardia, tachycardia. Now we will go to the rhythm. Rhythm can be regular or irregular. Irregular rhythm can be regularly irregular or irregularly irregular. Regularly irregular you get in conditions like ventricular bigeminy, trigeminy, etc. While irregularly irregular, the characteristic abnormality, as you all know, is atrial fibrillation. In atrial fibrillation, you will also get an apex pulse deficit of more than 10 as well as on auscultation, a varying intensity of first heart sound. So after that comes the next heading under which you examine pulse is the character. There are some important abnormalities in the character of pulse. Like in aortic stenosis, you get a slow rising, late peaking pulse, which you call it as pulsus parvus et tardus, because of the slow ejection of blood through the stenosed aortic valve. You can have a collapsing pulse or a water hammer pulse in aortic regurgitation, in rupture of sinus of Valsalva, AV fistula, etc., pulmonary AV fistula, where there is a rapid upstroke due to the increased stroke volume and rapid downstroke due to the peripheral runoff of the blood back into the aorta as well as into the peripheral vessels. You can have a bispherience, that is two peaks in the pulse, both in the systole. Pulsus bispherience is characteristically seen in severe aortic regurgitation or a combination of aortic stenosis with aortic regurgitation. Now, there is another abnormality in the pulse known as pulsus paradoxus, where the inspiratory fall, which is normally there is an inspiratory fall in the pulse, which is exaggerated in pulsus paradoxus to the extent that you will not be able to feel the pulse during inspiration in severe pulsus paradoxus. This is seen in conditions like pneumothorax, cardiac tamponade, acute severe asthma, etc. Now, after the abnormalities in the character comes the peripheral pulses. You have to look for all the peripheral pulses starting from the right radial, right and left radials, the ulnar, the brachial, the carotid, the superficial temporal, as well as lower limb, femoral, popliteal, as well as the dorsalis pedis. Sometimes the lower limb dorsalis pedis may be absent in 10% of the patients, but generalized asymmetry of the pulse or absence of pulse may be seen in elderly people due to atherosclerosis, in diabetes again due to accelerated atherosclerosis. In younger females, if you get an asymmetry of even the upper limb pulses, you think of conditions like vasculitis, Takayasu arthritis, etc. Sometimes in the upper limb alone, there can be asymmetry between right and left upper limb pulses, which is maybe a part of thoracic outlet syndromes like a cervical rib or a scalenus anterior syndrome. You also have to look for the radiofemoral delay as told in the first part of this video, that usually the femoral occurs earlier, 5 milliseconds earlier than the radial. In radiofemoral delay, it is the radial that occurs first, followed by femoral, that is seen in coarctation of aorta, which is distal to the origin of subclavian artery. So, thus the pulse is examined under rate, rhythm, character, volume, condition of vessel wall, and peripheral pulses. And when you are asked to examine the pulse, you have to say it under all these headings. Thank you.